Ladies and gentlemen, Dr. T. Mike Hsieh.
Thank you. Welcome to UCSD. I know this is the first year that we're hosting this, so it's super exciting, and thanks for the opportunity to speak. I know we're running a little behind, so I'm happy to answer a question at the end of the talk, or I told Kim I'm committed to stay for the breakout session as well, so if you guys have any questions, too embarrassed to ask, in a public forum. I know this is one of those sensitive subjects. For those of you who's new to San Diego, a little bit later, you get to go and watch the sunset, by the Pacific Ocean. So it's one of those things that you should do. So we're very fortunate. Testicular cancer is, despite being very common, we have very good treatments and lead to very high survival rate between surgery, chemotherapy, and radiation. About 95% or more of our patients have done very well. Unfortunately, that also means we got to follow them for a long time. So why is survivorship evaluation important? Because we know that some of these treatments, or all of our treatments, have some side effects. It could affect your nerves, your kidneys, your lungs. Some people also feel cognitively, their memory, they don't think as well. They can have cardiovascular disease, metabolic syndrome. We worry about cancer coming back, or could they get another cancer? There's obviously a psychological impact on being a cancer survivor, and sexual dysfunction and body image issues for a man to lose his one or sometimes both testicles. And the last thing that what I'm going to talk about is testosterone deficiency, and my partner here, Dr. Patel, will go over a little bit about fertility. So I tell all our patients, our body is super smart, and our testicles have two jobs, and they're very well compartmentalized. Within a specific part of the testicle called a seminiferous tubule, that's where sperm is produced. And in between these spaces, there's also specific cells that produces testosterone. So that's kind of how our body compartmentalizes these functions, and these are some of the things that can go wrong when you lose one or sometimes both of your testicle. So how common is low testosterone? It's found in approximately 12 to 16% of the guys after we just do surgery alone. Unfortunately, your chance for having low testosterone goes up after chemotherapy by about 1.8%, and this is a regular course. And then if you aren't somebody that responds well to regular course, you see Dr. Millar sitting in the audience, he'll give you additional chemotherapy to make you cancer-free. The more chemo you get, unfortunately, that also further increases your potential for developing low testosterone. And it's increased by 1.6 times after radiation treatment as well. So you can see that surgery, chemotherapy, and also radiation can all lead to low testosterone. Therefore, we need to keep an eye on all of you. So what do I do when you guys come see me? So we don't just check testosterone level. We check a multiple set of labs. First, we check the FSH. These are the signals from your brain to the testicle to produce sperm. We also check LH and testosterone level. These are the signals from the brain to tell the testicle to make testosterone. We also check prolactin. God forbid you have a benign brain tumor. We want to know about that. Okay, we don't just give everybody testosterone. And unfortunately, we're dealing with an overweight population. So if you have a weight problem, you can also have an imbalance between the testosterone and estrogen level. So we will also check your estrogen level as well. So you can see this is pretty much the blood test that you would get when you go see somebody and want to be screened for low testosterone. So why is testosterone important? I'm sure you guys all seeing tons of commercials, low T clinics. It will solve all your problems, including your financial problems, So but testosterone is important. It's one of the most important male hormones. It affects our whole body. For the skin, it's responsible for hair growth. And if you're middle age and you have too much testosterone, or we give you testosterone therapy, it can also lead to hair loss as well. For your brain, it affects your mood, your sex drive, and there's even some data that actually could affect your memory, your cognitive function as well. In the liver, it's responsible to help us produce certain proteins. In the muscle, it can increase strength and volume. That's why you see professional athletes abuse testosterone, because they help them run faster, jump higher, get a bigger sports contracts. In the sexual organs, pre-puberty, it's important to develop some of the differentiation from a fetus into a male. During puberty, is responsible for development of genitalia, and then as a man age, it can also lead to prostate growth. In the kidney, it helps us build red blood cells. That's why testosterone previously was used to treat anemia in patients undergoing dialysis. In bone, it can accelerate the growth and also stimulation of stem cells. So how do you know if you have low testosterone? In kids, we actually see that as well. This morning I saw a 10-year-old with Klinefelter syndrome, and it's something that he's born with. He didn't have cancer, but he has small testicle, and then we're concerned about, will he go through puberty properly? But these are some of the things we screen in prepubertal kids or in young adults. Gynecomastia, high-pitched voice, and they also have, could they not develop properly, grow to their full potential, build muscle properly. But late onset, these are probably the people that could be a cancer survivor or could be related to aging after losing a testicle. If you have low testosterone, you have lower sex drive, weaker erections, and you can also feel depressed and tired. And sometimes guys can even have hot flashes. Unfortunately, this is not very specific, right? Even every woman in the room thinks that you have low testosterone when I put up these slides. So that's why if you have concerns, then we would screen you, and if in the appropriate patient, we would treat. So why do we care? We know that it's not healthy to have low testosterone. And not only you don't feel well, you actually don't live as long. So we actually have long-term longitudinal studies looking at men over 18 years. About a third of these guys have low testosterone. And compare guys with normal testosterone to the guy with low T. What we found was that they have increased levels of inflammatory markers. They also have increased waist girth, so they're a little bit chubby on the belly side. They're 3 times more likely to have obesity-related diabetes, and they also have 14% greater risk for death. And this is confirmed looking at the VA population. We're comparing men with low T to normal testosterone. They also don't live as long. Therefore, we want to treat you because we want you to live a full life potential now that you're cancer-free. So what are some of the treatment options? This really kind of separate into men, do they desire future fertility? And in some of the cancer survivors, do you still have one normal testicle? If you have one functioning testicle and you desire future fertility, there are medications that we use to stimulate your body, to help your body make more testosterone yourself. In people that cannot do that, or they don't care about having children anymore, we also have a lot of good testosterone replacement options. This come in gels, come in injections, we can even do long-acting pellet implants, and we even have pills available these days. So there's a lot of options, and Dr. Patel or myself or any other urologist will be able to screen you appropriately and start you on a medication if it's in appropriate patients. So this is my last slide. Testicular cancer is highly curable. Unfortunately, we do have long-term side effects to these treatment, and if it's not addressed, it can shorten the survivor's life expectancy. And I think one of the special part about what Kim does is really awareness. It's not just testicular cancer awareness, but also we try to educate our survivors to know some of the stuff that you should be advocating for yourself. You know things to look out for, and hopefully have the courage to seek help.